So thank you so much, both Jamie and Amy, for your great ground-laying comments. As people take opportunity for their next physical activity experience, which is to head toward the mic with any questions or comments you have for the panel. I'm going to start with a question to both of you, and that's really around sectors. Jamie, you just made the point that we probably have to think a little more collectively and think about the connective tissue between sectors. And because a lot of the literature, a lot of the policy work has been done thus far in silos, I'll ask the question, if we really want to move the needle around physical activity in the population, what have we learned thus far? What do we know has really worked in the policy realm, and what holds the greatest promise? So I'll ask both of you for your comments on that as people approach the mics.
Well, as I alluded, we've done the most work and research in the education sector, but I don't think that's the biggest bang for our buck. I think the biggest bang for our buck is probably going to come, aside from sort of the collective impact, it's really going to come from much more community-wide strategies, such as changes to the infrastructure in the community that really can make communities a much more facilitating place for living, working, and playing on a daily basis. So your complete streets policies, your connectivity policies, building the infrastructure in communities through trails and parks that people can visit on a regular basis. I think that will encourage a lot more community-wide type of activity than just focusing on one sector, particularly since the school sector alone has so many challenges associated with competing demands for academic focus that it's important to focus on the education sector. The other place where I didn't really focus at all, and Amy didn't either, is in the early child care sector. And that's really an area we really need to put a lot of effort into, and I know the foundation in particular is doing that. And I think that's an emerging area to really put our heads around.
Also, people often think that we should approach schools, that's where the majority of the children are for a good chunk of their day. Maybe we should approach work sites because we all work, we all go to these places and spend a good chunk of our time there. But by promoting community policies, we're affecting both of those groups because the work sites and the schools are within the communities. And I think, as Jamie said, it's more bang for the buck promoting these community-wide policies.
Thanks so much. And neither of the two gentlemen standing by the mic need any introduction, but if you could introduce yourselves before the questions, that would be fantastic.
Kind of want to make up an identity here. Lowell Solomon, Kaiser Permanente. And Jamie, I was hoping you could expand on your comment about the paucity of longitudinal data. And I know there's this big hue and cry about whether we're getting selection bias when we look at communities that have active community environments and zoning and positive zoning policies and mixed use and trail networks and all that stuff, and whether that's attracting people that want to have an active lifestyle, or whether those environments are actually changing behavior compared to similar populations in different environments. Say a little bit more about the state of the evidence, and Amy, you might have some thoughts on that too, and whether just where we are in our understanding of those environments and changing behavior, holding out selection bias.
Thanks for the question. It's a great question. Actually, one that I ended my zoning talk with yesterday at the TRB meeting, which is the reality is I think my work is some of the first work to really study these zoning and land use policies and really sort of examine their association with physical activity behaviors. And so therefore, I can't really say what's coming first, the chicken or the egg. Having said that, I actually don't think the counterfactual is a bad thing for advocates, because if, in fact, the research is showing what I hypothesize it would show, which is that people are more physically active in communities that facilitate active living, great. But it's not such a bad thing either that people want to move to communities that support active living. And so they're purposefully selecting into those communities because they have more active living orientation through infrastructure, through policy, and things like that. So advocates could actually use it on either side of the coin and go and make a case for improvements to the community. We do need more longitudinal work over time across the country to really study truly the impact. I have a unique opportunity because with the zoning project, we have actually registered more code reforms or new urbanist type of zoning changes that are much more oriented towards pedestrian access and availability. And a lot of these code reforms have been occurring in the late, since 2010, 2008, 9, 10, 12, 13, particularly after Katrina along the Gulf Coast and other parts of the country. And so we have a unique opportunity now to longitudinally study the impact of some of those zoning changes on communities that have basically been rebuilt. So I think we need to do more in that area, and I appreciate the question.
Absolutely, and I think that being able to study these natural experiments would get at that. So if a policy, measuring baseline and things before a policy happens within a community and after would be very helpful. And there are some mechanisms from that. I know Bill Cole is studying transit expansion in Texas, but things like that can really build the evidence.
Eduardo Sanchez, I'm with the American Heart Association. I'm on the round table. Can you all talk a little bit about two things? One is the potential of modeling to help inform at least what decision makers might think about, one. And then two, to talk a little bit about your thoughts on how we cast the die, if you will, on funding. Because too often it's just it's a big number. We don't present the number relative to something else. We don't talk about not so much return on investment the way we traditionally think about it, but maybe what the health impact is for the dollar spent. So on the one hand, the potential of modeling, and on the other hand, how we might frame the conversations about funding.
Thanks, Ian. Thanks, Eduardo, for the question. Always simple questions that you ask. So I'll start with the funding thing first. I think, as I said throughout my presentation, that's sort of the underlying root problem that we have in this arena in terms of both implementation and studying impact. And I think the more that we can go speak to policymakers at a level where we can show, as you suggested, sort of that return on the investment, not just in terms of physical activity outcome, but economic outcomes, and making the communities a place where people want to live, work, and play. That's really what's going to resonate with policymakers. And Jim's in the room. I'm sure he has more to add to the conversation in this area. A lot of communities across the country have been engaging in health impact assessments, which are nice, but focusing on the health outcomes is important, but that's often not what most resonates with policymakers first and foremost. What resonates with policymakers is economic development and how they're going to sustain communities, particularly in those parts of the country unfortunately afflicted with terrible budgetary problems. And so how is having a healthier community, a healthier population going to impact that? And that's really where I think the focus needs to be in discussions about funding.
And as far as the modeling question, this is a good example of how we need to move outside of our silo and work with economic development and work with transportation and work with planners and come together to develop a model of best practices within communities so that we can then take that to policymakers and stakeholders for support.
Janet?
Hi, Janet Fulton from CDC. This has been great. This is just such a fantastic session. I'm wondering, you gave a lot of information about policies, what's out there, what's not. I'm kind of wondering about the transition from having the policy to implementing the policy? What are key factors that you know about implementing policies? What separates out the communities that have them, that don't implement, the ones that do?
I'm going to have to say it's funding and it's wording in the policy. So an example, in Missouri, again, 2008, we passed a policy or a state law requiring physical activity, 30 minutes of physical activity per day in each grade in elementary schools. And as Jamie mentioned, it didn't say PE, it said physical activity, and there was no money for implementation or enforcement of the state law. And just in talking with school districts around, they count walking from class to class as part of their physical activity as 30 minutes a day. So sometimes it's not implemented as intended just because of wording and funding. I would say that those are the two main pieces of the formal public policies.
And actually, Janet, thanks for the question. The other thing that we find, and this is where I started my talk with, policy making is incremental. We don't find universal compliance with these policies. All the evidence that I showed you about sort of what's working, reality is it's not 100% compliance in any single case. And so we need to figure out that missing gap. And the interesting thing is, particularly in the school sector, we look at why that is. Is it differences because of income? Is it differences based on race and ethnicity? Is it differences based on region? No demographic or socioeconomic characteristic is telling us why that's happening. It's actually what's happening in the implementation itself, and why it's not being implemented in the school sector. I have to believe it's about competing demands and time and how policies are worded. In other parts of society, in other sectors, part of it's will, part of it is understanding. We need to do a lot better job of communicating what some of these policies mean. And just like policy development itself, implementation takes time. So some strategies, such as zoning and land use, complete streets, those take a really long time to implement. And the worst thing that can happen to us in that area is the fact that administrations change, policy priorities change, things can get started and stopped very quickly. And so it's a constant battle. And so it really requires a concerted effort across multiple sectors to really help us hone in on the most important part of this is A, getting the policy on the books, and B, focusing on how to get it implemented successfully and fully.
Maya Feline with the MPH program at GW, as well as the adolescent prevention education programs at Children's Hospital here. I know you had spoke a little bit about the language used to define physical activity. I'm just curious how that's being regulated. I work with youth in DC, and I see firsthand that gym class literally is a class about gym. It's not really physical activity. Sometimes they're just learning about the rules of how to play the game. So I'm curious how that's regulated, and then if there's any efforts moving forward to sort of adjust the language on those policies.
At the state level, it really varies. Some state laws are very specific in the amount and type of physical education, or what is in the physical education class, or what is required throughout the day as far as physical activity within the schools. But as far as how that trickles down, the state law to being implemented in each school, in each classroom, by each teacher really varies because of the lack of mechanisms of implementation and enforcement that we talked about. Anything else?
And I think that's actually a really great question. It's a place actually that advocates could hone in on. It's in some cases it could be an easy fix if advocates in states such as through the Voices for Healthy Kids program from the Robert Wood Johnson Foundation, American Heart Association, could work with policymakers to make some slight changes in the laws such that not only do you have mandatory time for physical education, but include, and there are a number of states that have very specific standards about what PE is defined to include, and it must include, a certain amount of time spent in active time. But as our study with Jordan Carlson showed, just having that on the books isn't enough. It really is going to require a lot of excellent training and communication and technical assistance to schools about what that means and how best to successfully implement it.
And related to the Missouri state law that I had mentioned earlier, the word physical activity and physical education were the points of contention getting that bill even introduced. Went back and forth and back and forth. So some consistent wording or some best practices communicated to organizations or places wanting these policies would be very helpful.
All right, we have 2 people up and time for one more question.
Please.
Look at that teamwork. Thank you.
Islanders are very polite.
Sorry, I was going to suggest maybe we could arm wrestle, but I'm Jane Ward. I'm at Uniformed Services University, and I've also done some work with the Safe Routes to School program the last few years. And I wondered if we could go to what I consider sort of the elephant in the room, the fact that we are a car-based society, and I personally consider cars a lethal weapon. Lethal not only to those of us around the cars, but those of us in the cars. And I'm sure you're familiar with Howard Frumkin's writing on that effect, as well as the American Public Health Association sponsored study a few years back, The Hidden Health Costs of Transportation. So I wondered if we could at least throw out on the table a policy intervention which would be let the price of gas go up to the true cost of the price of gas with all the externalities factored in. And I'm guessing that might be $8, $10, $20 a gallon. And I'm not trying to be funny or to propose something that we'll say could never happen, but I think it should be out there. I personally am not anti-car. I drive a car occasionally, but I think that our car-based society is really driving our health down and down and down. And
No
I just
pun
wonder
intended.
what your thoughts are about that, or if that's come up in any of your sessions.
Absolutely. Jamie and I are editing a book on prevention and public health policy, and physical activity obviously is one of the chapters, and I do go into that very case study on gasoline tax and how it affects physical activity. And there's been some recent research on that increase in gas price can increase people actively commuting to work and walking and biking in communities. But if you look at it from a social justice standpoint, it's probably not the best recommendation, but framing it in a different way about tax incentives versus tax increases might be the way to go. But I agree that these natural experiments that have been studied show after Katrina and after the recession and the gas prices, how it has affected and increased physical activity. It's a good elephant.
Thank you so much. And Jamie and Amy, let's give Jamie and Amy some active applause. And